Hi, this is Arnie Aloff with Mainline Benefits. There's some huge changes coming to the Illinois market this year, and I'm here to tell you about them. On the under 65 or ACA market, we have 3 carriers leaving the state, which is going to be a big deal. We have the states becoming a state-based exchange instead of a federal exchange like it's been, and a short-term medical left. For the consumers, what this was going to mean to them is that they're going to have to make a change. Period. Just people are going to have to change their plans this year. In the under 65 market, we have a company called Health Alliance that's been in Central Illinois that's leaving. We have a company called Quartz up in Rockford area that's leaving. And then the big one that's been statewide is Aetna under 65. For the average consumer, they're going to have to go out and find a new plan. But the biggest issue we're going to have in Illinois this year is anyone that's been trying to do it on their own, they've been using what's called the federal exchange or the Obamacare website. The state of Illinois this year is going to what's called a state-based exchange. So not only do they have to find a new plan, they have to figure out how to navigate all this for themselves. And here at Mainline, we'll be able to actually navigate that for you and with you. We're the experts at it. We're already getting trained on it. We'll have it all down pat by the time November comes along. From the agent's perspective, there's going to be just an amazing, huge opportunity to actually be able to help and support the consumers out there as long as they're trained effectively. Agents around the country are freaking out about these changes, and there's a lot of them even considering leaving the business. We at Mainline, we're able to take these obstacles and truly turn them into solutions for the benefit of the consumer and the benefit of the agent. Keep in mind, Mainline Benefits was built by agents for agents. So what's great about us at Mainline Benefits is we're able to embrace these changes, embrace these obstacles to really make sure we're able to put a solution together for the consumer and for the agent. So one of the other changes that happen is that when an ACA plan doesn't work for a consumer is to look at something called short-term medical. The state has actually eliminated those policies in Illinois. So the question is, what do they do next? At Mainline Benefits, we've actually added additional carriers and additional products to fill the gap once short-term medical was taken away. On the Medicare side, for the changes in Illinois, for someone that's a Medicare beneficiary that also has Medicaid, or another way to say that is dual eligible, the plans that were made for them are all being terminated this year. For those Medicare beneficiaries that are dual eligible, what it means to them is that they have to go out and find another plan. Mainline Benefits really sees this as an opportunity from the standpoint is we're appointed and contracted with all 4 carriers that can replace what they currently have and make sure they really truly get into the right position. And this is really advantageous not just for the consumer, but also for the agents out there. Additionally, on top of all the changes in Illinois, nationwide, these subsidies, these enhanced subsidies are probably going away, which is going to completely change the marketplace and the cost of insurance for individuals. So these changes are not just a challenge for the actual consumers out there, they're also a challenge for us as an agency. We really need more agents on the street supporting these consumers. We have a short window to fill this void. If you're looking for an opportunity, we're looking for you. If you're the consumer looking for support, we have your back. Even though these changes are going to be challenging and difficult, we here at Mainline Benefits believe there's always going to be a solution.